So today we will be talking about the major depressive disorder, or the MDD, major depressive disorder. So how is it diagnosed? So we all know that depression is just this thing like whether is a person is sad or if the person has loss of interest. But clinically, how do you diagnose it? How is the diagnosis made? So in order to fulfill the criteria for major depressive disorder according to DSM-5, you need the following. Okay, you need at least greater than equal to 5 of the following symptoms for greater than equal to 2 weeks. For 2 weeks, at least one of those symptoms should be anhedonia or loss of interest or depressed mood. Okay, so all of these symptoms are given below. So out of these, we need 5. Okay, these are 9 symptoms, and we need 5 in order to diagnose a major depressive disorder, and they should be present for greater than equal to 2 weeks, and they should also include at least one of anhedonia or depressed mood. Anhedonia is loss of interest. So the first is sleep disturbance. So what happens with sleep during depression or major depressive disorder? So what happens here is that there is increased nighttime awakenings, increased early morning awakenings, and also there is a sleep called rapid eye movement sleep, or REM sleep. So the REM sleep latency is decreased. So what that means is that normally after every 90 minutes, we get to the REM sleep, another REM sleep. So when the REM sleep happens after 90 minutes, that there is another REM sleep. But what happens in sleep in major depressive disorder is that the latency of that of the REM sleep is decreased. So normally it is 90%. So for example, in a depressed individual, it can be like, for example, 60 minutes. So the REM latency is decreased, and the REM, okay, so decreased REM latency, but overall the REM duration is actually increased. Overall, during the sleep, you'll get more of the REM sleep. Okay, so that was the first one. Okay, then we have interest decrease. So anhedonia, this is the anhedonia that we talked about. So it should be like either this or this depressed mood should be present. So anhedonia is interest decrease or decreased interest. For example, a person may have enjoyed playing, let's say, a violin before getting depressed, and now he's not enjoying that activity. So then that was the second. Then number third is the guilt and our feeling of worthlessness. So the patient, may say that, it's just not worth it. It's like, I'm worthless, and there is hopelessness, and all of those kind of things. Then number 4 is the energy decrease. So the energy, there will be lethargy, or there will be tiredness. So the patient will just feel tired and will be laying on the bed all day, for example. So that's number 5th. Then number 4th, and then number 5th is concentration decreased. So there will be decreased concentration. So the patient is finding it hard to kind of focus on particular things. So, for example, if the patient is in a college, for example, so she may have like decreased grades in school or college because of the lack of concentration. Then number 6 is appetite changes. So some patients will feel like they're eating a lot, like the increased appetite, increased weight, and also others will have like decreased appetite and decreased weight or weight loss. So number 7th is a psychomotor agitation or retardation. So what that means is that the patient, like psychologically, there will be like agitation, like he or she will be moving. The patient will be moving like fingers, like in a tense way, and also in retardation is when there is decreased emotions. Okay, so like slow to react and stuff like that. So that's psychomotor agitation or retardation. Then number 8 is the suicide ideation, and that is important to know. So suicide ideation is the 8th one, and it can be like active or passive. So passive means, for example, wish to be dead. So the patient would say, I wish to be dead and not wake up. Wish to be dead, not wake up. So that's the first. And the active is when the patient is actually just thinking about killing himself. So thoughts of killing self. So this is important to to know. So they can be active or passive. And the ninth one is actually depressed mode. So yeah, depressed mode. So out of these 9, we need 5 to make the diagnosis, and they should be present for greater than or equal to 2 weeks. Okay. Then coming down to the types of the depressive or the major depressive disorder. So first is we have the persistent depressive disorder. So in persistent depressive disorder, it is a milder form of depression. So what happens in the persistent depressive disorder is that the symptoms are milder, but they are present for prolonged periods. For example, greater than or equal to 2 years. Okay, that's the diagnostic criteria. So they should be present for greater than or equal to 2 years, and they should be like greater than or equal to 2 symptoms of depression. Okay, then we have the major depressive disorder with seasonal pattern. So it is the depression symptoms, the same depressive symptoms, but they occur in a particular season. For example, usually it's a winter. Okay, and the treatment for that is similar to the major depressive disorder. In addition, you give light therapy. Okay, so you expose the patient to light therapy. Okay, light exposure, or light therapy is called. Okay, then we have major depressive disorder with psychotic features. So what happens here? So we have the symptoms of the major depression. Okay, major depressive symptoms. In addition to that, we will have psychotic symptoms. What are the psychotic symptoms? These include delusions. Delusions are fixed beliefs, and no one can change them. Are hallucinations. Delusions are hallucinations, and disorganized thoughts. Disorganized thoughts. So, major depressive disorder with psychotic features should be differentiated from schizoaffective disorder. So in that, the predominant symptoms will be the schizo, okay, the schizophrenia symptoms. Schizophrenia symptoms include delusions, hallucinations, and disorganized thoughts. And the disorder, the depressive symptoms will be present with this. Okay, so what that means is that for the psychotic features, the psychotic symptoms should be present for greater than or equal to 2 weeks without the major depressive disorder symptoms. Okay, in order to diagnose schizophrenia disorder. While in major depressive disorder with psychotic features, we should have the psychotic features will only occur in the context of psychotic features only in context of depression, okay, of MDD. So the psychotic symptoms should not occur alone if you want to diagnose major depressive disorder with psychotic features. They should only be present when there are symptoms of depression. Okay, the psychotic symptoms should only be present when there are symptoms of depression. While schizoaffective disorder, the depressive disorder should only be present when there are psychotic features. But in order to differentiate between major depressive disorder with psychotic features, we should have psychotic features without depression for greater than or equal to 2 weeks. So we have psychotic symptoms for greater than or equal to 2 weeks without the depressive symptoms. If we have that, then we will diagnose it as the schizoaffective disorder. Okay, so hope this was clear. So for the treatment is you can give the same major depressive disorder treatment for major depression with psychotic features, plus you can give antipsychotics. Okay. So that was these were the types of major depressive disorder. So then coming down to the treatment. So the treatment is the first line for the major depressive disorder are the psychotherapy and the SSRI or SNRI. So these are the first line. So psychotherapy is actually given like together with the SSRIs or SNRIs, and SSRIs include, for example, paroxetine or fluoxetine, citalopram, escitalopram, and SNRIs are serotonin norepinephrine reuptake inhibitor like duloxetine. So now the thing to be aware of about these selective serotonin reuptake inhibitors. So what they do is that they block the reuptake. So if this is the nerve ending and this is serotonin, so they will block this. And when they block this, there will be increased serotonin in the system, and that will improve the symptoms of depression, because it is thought that the depression is because of the lack of serotonin. Then and the other ones are the SNRIs, which are serotonin and norepinephrine. So both of these are blocked, okay? Both of these are blocked. So both of them will increase. So these are both first line, okay? First line for major depressive disorder. So the thing to be aware of about these antidepressants, they take 4 to 6 weeks for effect, okay? 4 to 6 weeks for effect. So you have to wait for that. And then another interesting thing is that in the early phases of initiation of these antidepressants, that they actually increase suicidality in young individuals or adolescents, for example, because but that that is really low. Like it's a really low risk. But if you are prescribing these to a young individual, you should you should talk about these things to that patient. Then, so one of the most common symptoms that patient will complain of with SSRIs is the decreased libido or sexual side effects, decreased libido or decreased desire to have sex. So that's that's one of the thing with SSRIs. It's a really common side effects. So, and because of that, you can actually use it for premature ejaculation because it decreases the desired premature ejaculation. So these can help with this side effect can help with the premature ejaculation. So then then we have another, which is norepinephrine dopamine reuptake inhibitors. So they will block both the dopamine and the norepinephrine, and this includes, for example, bupropion. And it is also, remember, it is also first line, okay? But first you have to give SSRIs. SSRIs, like they are at the top, okay? If they don't work, or you like tried different medications of this class, then you can give SSRIs. If they don't work, then you can switch to NDRIs and others like tricyclic antidepressants and immunomine oxidase inhibitors like phenelzine. These are actually just used for very resistant kind of depressions, okay? Really resistant depressions, you can use TCAs and MAOIs. So interesting about the bupropion is that they have no sexual side effects. So if the patient is feeling really a lot of like sexual side effects, you can actually switch them to this. Another thing is that they are weight neutral, or they do not cause weight gain. So no weight gain. So that's another important thing, and also help in smoking cessation. This is another drug that is important, and is the mirtazapine. And mirtazapine is actually, it increases appetite and causes weight gain. So now, if patient with depression is feeling a lot of like weight loss and there's decreased appetite, you can actually give mirtazapine. It can result in increased appetite and increased weight gain. Okay, so that's another drug. So these are all drugs that can be used for major depressive disorder. So hope you like this video and you like it helped you. So meet you in the next video, hopefully. So